go ahead and get started. Thank you everybody for attending today's session, Grant Writing Fundamentals 101. We're very happy to see you all today. I am going to stop speaking here very shortly and hand it off to OOCC Executive Director Steve Hsu to give us an introduction, and then we'll get into things. So without further ado, actually a little bit more ado, if you could just keep your microphones on mute, we'd greatly appreciate it. And we'll also be taking Q&A at the very end. We've got a lot of material to get through. So if you could use the chat box, the Q&A chat box, we'll monitor that for any questions and we will try to address them at the end. And now, without any further ado, I will hand it off to Steve. Steve, it's all yours.
Yes, thank you, Michael. And yes, that's enough ado, I say. And thank you, Michael, and the rest of the OOCC team for pulling together this event. Good morning to everyone. We appreciate your joining us today. We're very excited to bring you today's seminar, the OOCC Grant Writing's Fundamentals. The session is designed to help all organizations that are interested in applying for funding through our Competitive Grants Program. The session will cover the requirements of the call for proposals for fiscal year 22, which we released last month. Our goal is to help everyone improve the quality of their project proposals, which are due at the end of April. Today's webinar couldn't come at a better time. The work that the OOCC is supporting, which is the tremendous work that organizations like yours are doing every day, is more important now than ever. As with every other state in the country, 2020 was the most challenging year in Maryland ever from the perspective of substance use disorder. COVID-19 has complicated all aspects of our lives and has created tremendous stress and uncertainty for many people. That is especially true for people suffering from and living with substance use disorder. People with SUD have seen their support systems disrupted, and treatment has been more difficult to access during the pandemic. And although I cannot give you specific numbers today, I'm sorry to report that the year 2020 was the worst year in Maryland history from the perspective of substance use-related fatalities. We will address this in detail in our annual report for 2020, which will be released in the next few days. This increase is especially disappointing given that in 2019, overdose deaths decreased annually for the first time since the beginning of the modern phase of the opioid crisis over a decade ago. Although this last year has been hard on all of us, I'm still very optimistic about our future. I'm certain that by working together, we can meet the challenges of this difficult moment in our state's history. As previous years have shown, we have the knowledge, we have the tools, and we have the willpower to reverse the growth in overdose deaths once again. And together, we can work to save as many lives as possible. At the OOCC, we're doing everything we can think of to help reduce opioid-related mortality and morbidity here in our state. This includes our work to coordinate the state's response to the opioid crisis, of course. We work closely with our state partner agencies and opioid intervention teams, OITs, in each of Maryland's 24 local jurisdictions. You can find more information about these efforts and our priorities for the year to come in our interagency opioid coordination plan, which is about to be posted on our website. We will be releasing an updated version of the coordination plan with our annual report. So they'll come out simultaneously, so please keep an eye out for those in the next couple of days. Our efforts also include our work to support public and private frontline organizations like yours that are supporting people living with SUD every day. We are extraordinarily grateful for the work that you do, and we're excited to see what you will do in the coming year. We'll do everything we can to support your efforts. Lastly, before we get to today's session, I wanted to briefly share some of the accomplishments that OOCC grant-funded organizations were able to achieve in the previous year. This is just a portion of the amazing work that our partner organizations, including some who are on the call today, were able to accomplish. In fiscal 2020, OOCC supported programs conducted over 20 different PSA programs, campaigns. Collectively, these campaigns resulted in an estimated, believe it or not, 27 million impressions through television, print, web, radio, you name it. OOCC supported organizations conducted over 2,300 awareness or training events in local communities and schools. These events reached approximately 1.7 million individuals. Over 7,500 individuals were trained in naloxone administration, and over 4,000 doses of naloxone were distributed in local communities. Supported organizations also enabled more than 4,700 Marylanders with SUD to access treatment or recovery services. Over 4,500 assessments were conducted using SBIRT, and peer support services were provided to nearly 3,000 individuals. And over 3,000 individuals received mobile crisis services, and more than 21,000 students participated in youth prevention programs. These accomplishments are inspiring, and the OOCC couldn't be more proud of the work that you're doing. But there is more work to be done, we all know that. The challenges before us are great, and it will require continued dedication and coordination to overcome them. I'm confident that we can overcome them together. With that, I would like to again thank you for attending today's webinar, and I want to thank you for your dedication, your advocacy, and your partnership and all that you do to help those in need. 2019 offered our first glimmer of hope in this fight. One of the most tragic consequences of COVID and its interference with this progress. But the coronavirus pandemic is now nearing its end, thankfully. As Maryland continues to make COVID-19 vaccines available to everyone who wants one, the end is in sight for one of the two public health crises that we are facing. And together we can bring an end to the opioid crisis as well. So thank you, and I will turn it back over to you, Michael.
Great. Thank you so much, Steve, for that wonderful introduction. And with that, we will get right into our webinar. Our first speaker is Danielle Holmes. Danielle, I will pull up the presentation. Give me just 1 second, but I will turn it over to you.
Great. Thank you, Michael. Good afternoon. I'm delighted to be able to speak with you all today about the OOCC Competitive Grants Program. As Michael's pulling up our PowerPoint today, wanted to Perfect.
Danielle, you're a little faint. If you're able to get closer to your microphone, that might help.
Okay. Does this help at all? Test, test, test.
I can hear you all right, Danielle.
Okay. All right. Well, let's go ahead and get started. Michael, you can go ahead and jump to our first slide. So the OOCC operates two distinct grant programs, the Block Grant Program and the Competitive Grant Program. The purpose of the Block Program is to provide some level of funding to all 24 opioid intervention teams in order to combat the opioid crisis in whatever manner they best see fit. The OIT is chaired jointly by the health officer and the emergency manager. The health officer provides the subject matter expertise while the emergency manager provides organizational leadership. The 24 OITs are responsible for developing the jurisdiction's annual opioid mitigation plan and a variety of other tasks. Teresa Heath, our OIT coordinator, is going to be talking in just a few minutes more about the OITs and how they can be helpful to you as you're preparing your competitive grant application. The second grant program managed by the OOCC, and it is the topic or the program that we'll be focusing on this afternoon, is our competitive grants program. The goal of the program is to distribute grant funding to the highest scoring proposals received from state and local governments and community-based partners. These programs should align with the Interagency Opioid Coordination Plan, which Executive Director Hsu mentioned a moment ago, and the funding available for this program is approximately $5 million. Jumping to the next slide, Michael. So as mentioned in the call for proposals, all projects should align with the 3 pillars of prevention and education and safety and treatment and recovery. The slide here is just a quick overview of the coordination plan, which is available on our website. We will have an updated one, as Director Shue mentioned, but the goals and strategies will remain unchanged. So those are found on our website under the resources tab. You'll see the interagency opioid coordination plan, and then those goals and strategies begin on page 15. And if you have any questions as you're, and we'll talk about this more in the application, but if you have any questions about how your program fits under one of these goals, feel free to reach out to us directly and we'd be happy to work with you on that. With that, Michael, do you want to slip to the next slide, maybe one more slide? We thought it would be a good idea to share with you an example of a project that was supported by OOCC funds in FY21. This is a video produced by Carroll County Public Schools. It is a prevention and education initiative that will become a permanent part of their health curriculum. And so we thought we'd share maybe the first 2 minutes. It's about a 22-minute video, but we can make it available to you after the webinar so that you can have an opportunity to view it. So assuming our technology cooperates, take a look.
A calling will become clearer when you take the first step. Pretty cool sitting here in the Triangle Recovery Club next to some of your talented work.
And that light that's in his chest, you know, once he's in the other chairs, is going to grow bigger, you know, and the whole idea of the ripple effect, like, it has that meaning to me. When I was in that seat, I thought that was it. You know, I was like, thank God, after all these years of struggling, I am capable of feeling better, right? But I realized that when I was sitting down with somebody else that was sick and trying to help them and watching that light shine in them after they were, you know, living in a place of darkness, like, that's like the good stuff right there. You know what I mean? That's the reason why I keep doing it and keep doing it and keep doing it, is because I want to see more.
You may not know where it will take you, but to start a journey, all you need to do is to find the right track.
My name's Travis Shields, and I was addicted to drugs for 15 years. Probably 10 or 11 when I started drinking and smoking weed, and it was just like normal to me because I found the kids that were doing that too, you know, using drugs and smoking weed, drinking and stuff like that. Like, we, you know, I kind of felt normal for the time being.
Starting with the weed and drinking eventually opened the door for me to do so many other things, you know, by the time I got into high school.
Do you think if you had other ways to cope, it would have made things better for you? Do you think if you had other avenues to go? Because when I was using, I felt like I only had one way to go. Like, I never knew about these certain other ways I could, like, find help.
My name is Tim Weber. I was addicted to drugs and alcohol.
Danielle, was that far enough in the video?
That's perfect. Thank you. Again, we'll make that video available to everyone. It really is an excellent video that captures the power of addiction and recovery. Moving on to the next slide, Michael, we'll go ahead and jump right into things. As I mentioned, the overview, this grant opportunity is open to all Maryland state agencies, local governments, and non-governmental organizations. The full application package should be submitted to the OOCC electronically by Friday, April the 30th. So the full application package, 4 major components. First, the application form. Second, the budget template with any relevant attachments. Third, organizational information that's specific to non-governmental organizations. And then lastly, support of the project. And we'll dive a little deeper into each of these items as we move forward. I wanted to touch on the funding specifications briefly. A grant applicant can request funding from $5,000 up to $500,000. Historically, the OOCC, their grant awards have ranged between $100,000 and $200,000. The grant award is for one fiscal year, beginning July 1 and going through June 30th of the subsequent fiscal year, or through the subsequent calendar year. Grant funds can be used for staff salaries, fringe benefits, office expenses, consultant fees. It can be used for a limited amount of essential equipment and minor infrastructure projects. The OOCC generally does not fund major capital projects, but if your organization is interested in pursuing a major capital project, please get in touch with us. We'd be happy to refer you to the appropriate department who assists with those sorts of initiatives. The list of costs that are impermissible is a little bit shorter than what's allowed. Those are detailed in the call for proposals, but include things like fundraising or lobbying costs, pre-award costs, depreciation expenses, and food costs, except for certain.
Danielle, it looks like we may have lost you. So if you can hear us, bear with us just one moment. I can see you now.
Can you hear me?
Yes. Great.
Okay, perfect. Perfect. I can always call in if we're having some issues. So diving into the next slide, Michael, the project summary section is pretty straightforward. Perfect. Thank you. The project title, jurisdiction, and applicant organization, again, very self-explanatory. Moving into the main objective, while the project may address more than one objective, the goal is to select the primary objective. So whether that's prevention and education, enforcement, and public safety, or treatment and recovery. Also, new to FY22, we've added the main strategy. So we want to select the primary strategy from the drop-down menu. And those strategies are going to be found in that interagency opioid coordination plan that we talked about a little earlier. And then lastly, the total project costs. We want that to include indirect costs, and that should match up exactly with that budget template. And Khalil Kater on our team will be talking about that more here in just a moment. The second section of the application is the project summary. The project summary should provide a concise summary of the applicant and the proposal and be limited to about 150 words. We suggest using the template that's provided in the call for proposals if possible. So this section is basically your 30-second elevator pitch to the scoring committee that will help guide those committee members through your application. So we're just hitting the high points. And I'd also mention that it's particularly helpful to just mention whether this is a continuing project or expansion project. That's a question that comes up often. So it's just helpful as the committee members are working through the application. Next slide. The next section is the problem statement and needs justification. So the goal of this section is to describe why the proposed project is needed and therefore is important to pursue. We want to identify the most significant issues, problems, trends, and opportunities. And then new to 22, we've added an additional section that asks applicants to describe the target population in greater detail and the project's impact on the population. So I've included here a couple of different resources as you're working through that section of the application. Of course, the Census Bureau has a lot of great demographics data, Department of Health, local health departments. So I think that should be a valuable resource. So we're adding this particular section. If you have any questions as you're working through that, again, feel free on any of these items. If you have questions as you're working through the application, don't hesitate to reach out to us. Slide. Perfect. The goals and objectives and program measurement performance indicators section of the application, I'm not going to go into great detail on that because Nicole Sealfon who is the Associate Director of the Behavioral Health Resources and Technical Assistance Program at the University of Maryland School of Pharmacy. She's going to talk to us in just a little bit more about those goals and objectives and performance measures. It's been a particularly challenging section of the application, and so we wanted to spend some time just understanding that section a little bit deeper. And so Nicole is our expert in that area, so I'm super excited to hear her present on that issue because it's such an important part of the application. The next section of the application is the timeline. So the goal of the timeline is to describe the key tasks that have to be carried out in order to implement the program. We want to know them responsible for seeing that each of these tasks are being completed, the target dates, and time frame for achieving objectives. So I've included here an example from one of our applicants in FY 2021. You certainly do not have to follow this exact format, but I thought it was just a great example of just an organized timeline so that the scoring committee it's clear when certain things are planned to happen. All right, next slide, Michael. All right, we're coming down towards the second half of the application. So the spend plan section defines the major categories that are contained in the budget and provides the basis for and defends cost projections. And it also will detail any other grant opportunities that your organization might be seeking. Now, this section of the application has been confusing to some applicants in the past because it almost seems like we're just asking you to copy and paste the budget template and just providing duplicate information. But it is slightly different. So the spend plan narrative allows the scoring committee to be able to understand how the budget template actually connects to the project itself. So, for example, maybe the budget template includes $10,000 in consulting cost. The spend plan section would help the reviewer understand that how these consulting costs actually connect to what the project intends to do, and it also might include like how was this consultant selected. So that is the specific goal of that spend plan description. It's narrative in nature, just serves as kind of a lens through which to view the budget template. And then the last section of the application is the sustainability plan. And we want to know how this program will be sustained financially in future fiscal years. The OOCC's competitive grant programs are intended to be one-time sources of funds. So in other words, the scoring committee is going to prioritize new or expansion projects that have a strong sustainability plan. So here's an example here that Talbot County Public Schools, their sustainability plan included a request to the County Council to support the position in the future. There is some planning involved in how this project will be supported in future fiscal years. Now diving into the fun part, Michael, the next slide. The signatures. The signatures have proven to be the most challenging for grantees in the past, just trying to figure out what signatures are needed and how to go about getting them. So this slide, I think, hopefully helps to organize the information and make it clear what signatures are needed. So in most cases, the project is going to be impacting one jurisdiction. And so what we're looking for is a signature or letter of support from the local health officer or deputy, or the local emergency manager or their deputy, and the county executive or their equivalent. For projects in Baltimore City, things are going to be handled a little bit different. The Baltimore City Health Department has asked that all requests are directed to Brittany Spencer. She's going to take care of getting the signatures that are needed from the health department and sharing it with the local emergency manager, and then also assisting with getting the mayor's signature, that particular project. But That is important to note because they are asking that those requests make it their way by April the 16th, so they have time to turn that around. For projects impacting 2 jurisdictions, it's going to follow that same pattern. We're just asking for 4 signatures, so 2 from each of the jurisdictions. And then lastly, just to keep organizations from having to get 2 signatures from every single jurisdiction, if your project is covering the entire state or covering 8 or 9 different jurisdictions, it could be really difficult to obtain that many signatures. We simply suggest that a signature or letter of support come from the relevant agency secretary. For project would impact the Department of Health, we've provided in the call for proposals 2 places where those requests can be sent. Depending on the project, they will either be directed to Dr. Chan or Dr. Jones. So the contact information on how to reach those 2 individuals are contained in the call for proposals. And Teresa Heath will be talking shortly. If you have any challenges as you're working through these signature processes and just running into any challenges, we're here and we're happy to help. Next slide, Michael. So I wanted to quickly touch base on the requirements for non-governmental organizations. There's an additional checklist of items that we request of non-governmentals. First of all, financial statements. We're looking for a profit and loss and balance sheet from the prior calendar. Financial audit. This is only if you are already audited. A statement of good standing from the State Department of Assessments and Taxation. Michael, if you can advance to the next slide, I wanted to provide a little helpful tip on how to access the State Department of Assessments and Taxation standing. So organizations can request a formal letter or certificate from the State Department of Assessments and Taxation, which we would be glad to accept. It may be just as easy and simpler to simply go to the Maryland State Department of Assessments and Taxation website, click Business Entity Search, type in the name of your organization, and this is the type of information that would pop up. So you can just send us a screenshot or save that document, and that just confirms that your business is in good standing. So again, that's simply going to the State Department of Assessments Taxation website, click Business Entity Search, type in the name of your organization, and that should pop up pretty easily. Michael, if you want to go back to that earlier slide, I'll wrap up the 2 other documents. So we're also asking for any copies of any licensure or certifications that are necessary to operate in the state of Maryland. If your organization is undergoing any investigations, this would be the part of the application where it'd be helpful to know that sort of thing. And then last but not least, the IRS nonprofit determination and IRS Form 990, if that's available. And then we just ask that you include a table of contents with these documents. That just helps us, since all of these documents are sent electronically, that helps us to know that there was, there might be a document that was perhaps missing. And so it just serves as a checklist for us on our end. And then additionally, letters of support are welcome, whether you're a state agency, local government, or non-governmental organization, but are not a requirement. Moving into the actual award stage. So the process that we go through to review these applications, Michael, if you can advance to the next slide. So to evaluate these proposals, the OOCC impanels a grant scoring committee comprised of parallel work groups to score each project. Committee membership consists of OOCC staff, subject matter experts from various state agencies and non-governmental organizations that have experience responding to the opioid and substance abuse crisis. The grant scoring committee will evaluate the proposals based on the criteria that I'm going to mention in the next slide. But before I do that, I just wanted to provide some information on our 3-step review process on all grant applications. The OOCC finance and grant staff will perform an initial review to confirm that all of the application contents are there. If you're able to give it to us a few days in advance, I'd like to say the day of, but if we have so many applications coming in the last minute, we review them as quickly as possible and try to get back to you if there's any documents missing. But just give us a few days. We'd be happy to just make sure all of the contents are there, and we can let you know if that's not the case. So we'll perform that preliminary review, and then once the application has passed, our team will do a second detailed review just to make sure all of those documents are there and on file. Then the OOCC Grants Scoring Committee will perform their careful work of reviewing and scoring each application. And then lastly, the Scoring Committee will then submit a recommendation to the OOCC Executive Director, who then makes a final determination on the committee's recommendations. So once that takes place, board grant agreements are prepared. Our goal is to have everything, all the documents executed and out by July 1. That was unfortunately delayed because of COVID for FY 2021, but that is our hope and our expectation for FY 22, so that the projects can go ahead and start July 1. Moving ahead, Michael, the different scoring criteria that I referenced a moment ago, these are the seven different criteria. First of all, the project aligns with one or more goals of the Interagency Opioid Coordination Plan. We've mentioned that a couple of times. 2, we want the project application to provide a brief and clear summary of the project, and the problem statement section describes why the project is needed and identifies the most significant issues, problems, trends, opportunities. We're also looking to make sure that target population information is included. For the next item, these goals and objectives and performance indicators, we want these responses to be specific, measurable, attainable, relevant, and time-bound, which Nicole will talk about momentarily. The goals and objectives and performance measures actually correspond to the project for which the funds are being requested. The timeline, we want the timeline to contain key tasks required to successfully implement the project, just as we discussed a moment ago. And the timeline suggests that these funds can actually be spent by June 30th, because since these are general funds, we're not able to allow an extension. The spend plan section, we want the spend plan and budget to provide adequate detail regarding each budget line item, and the applicant adequately explains how each item in the spend plan is necessary to the project's success. Again, the sustainability plan, that there's prospects for ongoing funding at the end of the grant period. And then lastly, financial viability. The organization has a proven record of success and is in sound financial standing, has adequate financial management systems, and is capable of managing grant funds, and prevents the strong likelihood of achieving the overall objectives of the grant. So each criteria has a maximum of 15 points. The financial viability has a maximum of 10 possible points, 100. That's a little bit more information about the criteria that the scoring committee uses to score each of those proposals. From here, I'm gonna, Michael, I guess I'm gonna send it back to you, and then I think Khalil's gonna talk a little bit more about the post-award process.
Great. And I'm sorry if I missed this next slide, but I will hand it over to Khalil. Khalil, take it away.
Before I start, let me just make sure, am I coming through okay? Can you hear
Yes,
me
sir, we
all
can
right?
hear you well.
Okay, actually, would you hop back 2 slides to talk about the post-award stage? Thanks. If there are any local health departments on the line, this has changed from FY21, so I just want to talk about this really quickly. Reimbursement requests obviously are submitted by the grantees on a quarterly basis to me, either to my email address or the finance email address, and this is detailed in the grant agreement that you'll receive. I want to receive these quarterly, so at the end of each quarter, along with the rest of the reporting from the grantees, and it will contain the expenses from the prior quarter. The important one, well, they're all important, but the most important one to note is the very last one for quarter 4 of the grant period, quarter 2 of the calendar year. It's going to end in June. but the final period of reporting is due 30 days after July 30th. So that's what we're looking for. Budget modifications, if any project needs to be modified, we can do those anytime throughout the grant period. So that's important to know. All right, Michael, go ahead. Thank you. Okay. So the block grant program, which is available to the local health departments, uses the Department of Health's 4542 budget template. This is familiar to you if you're part of a state entity or otherwise part of the state system. The competitive grant program uses a different template that we've made. It's a little friendlier for nonprofits and doesn't include a lot of state accounting information that's otherwise unnecessary. However, if there are county or city health departments or state entities that are on the unified funding document, they're going to be using the 4542 for both grant programs. That includes the AOBJ, which is part of the finance system for state entities that we also use for reimbursement. This information is important for their reimbursement, like I said, because it will include that finance information. Along with the spend plan, each item on the budget is going to include a description of the purchase of the service, specifically for under salaries and fringe benefits related to staffed positions. We want to identify the people that are being funded by the grant program. These items are should be reflected also in the project narrative and vice versa. So for example, if your project narrative says we're going to fund so many events, each event should be mentioned also on the budget. Next slide, please. Thank you. This is a brief overview of what the competitive grant budget form looks like. The sections are all laid out here. It looks like the very first, salaries and wages. So these are your staff costs, not including fringe. Fringe in this case includes FICA, so your Medicaid and your Social Security, and then other fringe benefits that you would attribute to staff that's paid for under this grant. Your next section is travel for your grant project, fairly self-explanatory. The next section is equipment, also fairly self-explanatory. This will include long-lasting assets, so machines or laptops or tablets or things like that. You wouldn't include office supplies in this. That would go under the next section, materials and supplies. Materials and supplies not only for your regular office stuff, if that's part of whatever your grant project application is, but also your advertising materials, your posters and flyers, things that you need to purchase to proceed with your project. The next section is going to be training and development. These are things, not only training that you would pay for as part of your grant program for persons that are on your staff, but also the payment for training that is being provided to recipients of your grant program. If you're providing training to at an outreach event, such as naloxone administration, and there's a cost related to it, this is where you might put that cost. The next section is contractual services. That's also fairly broad if you need to pay for a contractor to fulfill a part of your grant project. For example, if you want to purchase a billboard and provide advertising on that billboard for a Goes Purple event or an awareness campaign, that would go under your contractual services because you're purchasing that contract from the billboard company. Just an example, not a hard and dry. Because if you have anything that might not fall into those, it will go into your other section below. Items not allowed with any of those things above. There are a few more sections on the next slide, I think. Here we are. So the totality of those previous categories is going to roll up onto your direct costs, and the next line will be an indirect cost. Your indirect costs attributed to the program do have a limit. It's 10%. And it's calculated on some, but not all of these sections above. Your personnel, operating costs, travel, and other costs up to $25,000. However, it doesn't include equipment that has a single cost of $5,000 or more. That would not be included in this roll-up. The formulas on this form are all set up to roll up automatically So if you find that part of your project includes an equipment purchase that falls under this rule, you would need to exclude that. All of these rules are also identified on the grant agreement and the budget form when you apply. So yeah, you're free to take notes, but these rules appear in many places. Next slide, please. Okay. The OOCC provides a reimbursement form that you're going to use for the quarterly reimbursement, like I mentioned earlier. The budget that you provide with your grant application, once it's approved and awarded, is what I use to build your budget form. Only the lines that have a cost or an expense that you've identified on your budget are included in the form, so that when you're submitting for reimbursement, you can select from the lines, that were approved. So if you're going into your reimbursement form and you, for example, were to say, I want a expense reimbursement for a material and supply, but that wasn't included as part of your project, it wouldn't show up under that drop down, and we'd have to talk about how to get that into your project through a modification or otherwise. And that's essentially what the next bullet point talks about. It's put as a reminder to take a look at what expenses were approved when you're submitting for reimbursement. Generally, it should only be things that are on your project application. And if they're not, then please contact us and we'll work through what opportunities there are and what alternatives there are, or if the costs are to be disallowed. Next slide, please. I believe it's now our Nicole Silva's turn. Michael, I'll turn it back over to you.
Great, thank you for that information, Cleo. And just we're running, I just want to make sure before we run out of time that I am tracking everyone's questions. I've got a few of them. We will address them at the end if we can get to them. And if not, we will certainly reach out to you after the webinar. But without further ado, I'll hand it over to Nicole. Nicole, take it away.
Sure, thanks for having me. Hi, Nicole. So I'm going to just walk through some tips for identifying goals, objectives, and performance measures. So you can go to the next slide. So what are program goals? They're the central aim or desired outcome of your program. So you're going to make sure that they describe the problem, and you can use statements such as to increase, reduce, to reduce, or etc. like that. And then your program objective goes along with what to kind of meet your goal. So it's a concrete statement describing what the project is trying to achieve. You want to make sure that your objectives are specific, measurable, achievable, realistic, and time-bound. And so the objective should be written so that it can be easily evaluated or assessed, in a formal evaluation, if need be, at the conclusion of a project to see whether it was achieved or not. And so by writing it as a SMART objective, it will help you meet these needs. So you can go to the next slide. So what are the components of a SMART objective? So you want to make sure that they're specific. Objectives should provide the who and the what of your program activities. Using only one action verb, since objectives with more than one verb will imply that you're doing more than one activity or behavior that will be measured. And we want to make sure that they're measurable. So this is really important. The focus is on the how much change is expected. Objectives should quantify the amount of change expected. It is impossible to determine whether objectives have been met unless they can be measured. So you want the objective to provide a reference point from which a change in the target population can clearly be measured. Achievable. This is really helpful to make sure that you're selecting objectives that are attainable within the given time frame. And with the available program resources. So, you don't want to select something that's crazy because you only have 1 year and you also have limited budget. So, and that kind of goes along as well with realistic, that objectives are most useful when they accurately address the scope of the problem and the programmatic steps that can be implemented with that specific time frame. Objectives that do not directly relate to your program goal will not help toward achieving that goal. And then the time bound. Objectives should provide a time frame indicating when the objective will be measured or by which they will be met. So including the time frame, once again, helps in kind of planning and evaluating your program. So you can go to the next slide. So this is just a quick little summary. It's kind of small, but I can send that. So your relevant objective has the who. So who will be impacted by the outcome, or who can help execute this outcome? What is the desired outcome? When will this outcome occur? And how much do you want your outcome to change by? So one example of an objective structure would be, who will conduct intervention resultant in what, and how much by when? So one example of a SMART objective would be, by the end of the school year, 90% of youth participants in middle school will define addiction as a disease. So we're going to test your objective writing skills on the next slide. So, well, we kind of got both. You got kind of the first answer by the second question. But first, you can still answer, is this a SMART objective to provide naloxone training? So, yes or no, you can go ahead and select that. And then if you want to go ahead and answer the second question, it's okay to just say, sort of gave it away, but if this objective is not SMART, why is it not a SMART objective?
Nicole, can you see the answers to the poll questions?
No, not. I think when you close it, if you want to close it, if it has have most people responded.
Yeah, we're getting a good chunk in. I'd say about half of people have responded.
Okay. All right, you can go ahead and close it. That's fine. So see if we can see the response.
In the interest of time.
Yeah.
Okay. It is giving people 15 more seconds to submit their answers, so stand by.
Okay. So, so most of you were able to identify that just write in provide naloxone training is not a SMART objective. And and most of you also were correct in selecting that all of the why it was not a SMART objective. So it was not specific, it was not time bound, and it was not measurable. So if you go ahead and move to the next slide. So if we were to then change it from the very broad general provide naloxone training to, by the end of the grant year, X agency staff will have trained 100 residents at naloxone trainings in their community. So now this objective has been written as a SMART objective because we're specifically indicating who is responsible, how many will be trained, and by when the trainings will occur. So you can go to the next slide. So the next thing to help with seeing how the impact of your program is to identify performance measures. So performance measures will help tell what your program did and how well you did it. So you have two different types of data. You can use data to summarize and assess the way a program is being implemented, as well as data about a program's operations and outcomes. So some examples of performance measures are measures that kind of assess program participation. So who is participating, like your participant characteristics, how many participants, and their level of participation. So examples include number of individuals trained in SBIRT, your program attendance rate, and number of clients. And you can even break it down by, say, diagnosis or other demographics that are of concern to you. As well, then another example are types of outputs. So which are the activities that you're implementing to sort of measure that those activities. So number of education sessions conducted, number of naloxone doses distributed. We can go to the next slide. So some tips on writing your performance measures. It's helpful to be just clear and concise. There's no need to write a whole narrative. Just use a table. That sometimes is helpful to just sort of have your activity that you're implementing, and then with bullets and the performance measures that sort of will help assess that activity. Remember to identify data measures that assess how your program is being implemented, or data that you are able to collect to show outcomes of your activities. You want data that obviously you either have access to, or you can easily develop tools to collect those measures. So if you want to go one more poll for you guys, I guess if we want to just throw this in the chat, or did you do another poll, Michael? Okay, so if people want to throw in the chat some performance measures, if you're peer programs is a popular strategy or activity that people tend to, I think I was told, implement. So what would be performance measures for activities for a peer program? Go ahead and just enter those into the chat, and we can just see what people have ideas. We have one.
Nicole, can you see the chat?
Yeah, I see it. So we have number of peer counseling sessions, number of clients per participants, number of clients, number of services offered. Those are all good examples. Number of peers trained, number of clients that participate, how long the clients have remained. Yes, retention is a really good measurement. Number of persons connected to MAT services through peer outreach during a specific quarter, number of referrals. Great. So those are some great examples. Pre and post survey of clients, survey the impact. Yeah, if you're able to really get into impact, that takes it to that next level of sort of the evaluation of impact, and the performance measures can be more on just the implementation. So that comes down to resources, but you can have, if you have that evaluation, you can even just have like the number of surveys collected and such things like that. So that is it for me.
Great. Well, thank you so much. I know I learned a lot. I've never written a SMART objective before myself, so that was very informative for me. Thank you very much, Nicole. And with that, we've got about 5 minutes left. I'm going to hand it over to OIT Coordinator Teresa Heath, who will bring us home. And I think just before handing it off, that the presenters will stay on the line, if that's okay, for maybe 5 minutes after the session, just to field a couple of questions. We just want to be respectful of everybody's time. So with that, I'll just hand it over to Teresa.
Thank you, Michael. So I'm the OIT coordinator for the OOCC, and as Danielle mentioned earlier, each of Maryland's 23 counties and Baltimore City have an opioid intervention team. These groups meet regularly to coordinate the response to the opioid crisis in their local jurisdiction. The OITs are chaired by the local health officer and emergency manager, and also include representatives from local agencies as well as community organizations and providers. I know that Danielle talked a little bit about signatures earlier, but in addition to providing the necessary signatures for our OOCC grant applications, your local OIT can also be a really great resource for sharing information and partnering in your work to address the overdose crisis in your jurisdiction. And community partners like those of you on the line today play a really important role in the OITs and the overall response throughout the state. So I encourage you to reach out to your local health department to inquire about their OIT. And if you have trouble connecting, please feel free to reach out to me. My email address is teresa.heath@maryland.gov. And just one more thing about signatures. As you can all imagine, local health departments and offices of emergency management have been extremely busy with the COVID-19 response and now with the vaccine clinics. So please be mindful of that as you're submitting applications for their signatures. In our application, we recommend giving them as much time as possible, but no less than 5 to 7 business days so that they can give a thoughtful review and get you the signature that you need in time. But I certainly stress that they're extremely busy, so as much time as you can give them, please do so. And also keep in mind that you'll need an additional signature from county or city leadership. So the earlier, the better. And with that, Michael, I'll hand it back over to you in hopes we can answer some questions.
Great. Oh, thank you for that information. Let's see. Let's just get to them because we know we're short on time. Let me just stop sharing my screen here so we can see the participants. Okay, so from very early on in the session, we had a question from Amy Park. Her question was, can OOCC funding be braided with other sources of funding? I guess that's for Danielle or Khalil.
Sure, yes. So certainly the OOCC grant funding, I think a lot of our organizations are braiding together various funding sources to be able to support a specific project.
All right, and we'll just go through them. So let's see. Another question was that the implementation period for the grants was this is coming from Ann Herbst from 7/1 to 6/30/22. So the beginning of the fiscal year is July 1st, ends in June 30th. That's correct. So I just wanted to verify the information from earlier in the session. Next question is we have from.
Can I comment just briefly on that? So yes, the fiscal year does run from July 1st through June 30th of the following calendar year. I would just mention that obviously that's contingent on the grant agreement being executed. So we do our very best to have that by July 1st, but we ask that grant award recipients do not begin their project until that grant agreement has been executed.
Wonderful. And then let's see. Casey Dyson asked if a list of previous grantees can be made available. And I know the answer to that question is yes, it's on our website. I will send you the link after the fact to where you can find it, but it should be under the resources or the news section when we announce the award winners for, or the grant recipients for the previous fiscal year. Let's see, Christina Bowie asked that county executive signatures if they were also required on for letters of support. And I think you had already addressed that, which the answer is yes, either the city or county leadership is required. And then, let's see, we've got a question from Melissa Rosenstein. Her question is also about letters of support, but she says, I am with a state agency, Office of the Public Defender, applying for a statewide project. Is the head of my agency, the Public Defender of Maryland, the signature needed, or should we be reaching out to the contacts provided at MDH?
I think it's more than appropriate to use your agency's director as a signatory, standing in secretary. I think that's more than appropriate. I think there was also a question related to letters of support, Michael, and whether or not we had a template. We do not have a template available. Typically, most signatures, they'll just use the application itself and that particular signature line. But there are some cases where certain offices would prefer to elaborate on that, and so we allow those organizations to be able to do that. Again, it'll just depend on that particular health officer or county executive or county administrator.
Great. And it looks like we are right at 1. But I mean, I guess if the presenters don't mind, we can hang around for a few more minutes. So there's a few more questions we can get to, I think. But I'll get to them. If you have to leave, completely understand. Thank you for attending, and do enjoy the rest of your day. But if you can hang around, we're happy to answer just a few more questions. So yes, the PowerPoint will be made available after the fact. I found a really good one for you, Khalil. So the person asked, and I just lost it, I'm so sorry. So Tamara Mills asked, under the travel category, will we be able to continue to pay for registrations for virtual conferences?
That's a good question. The travel category is a reasonable place to put registrations for virtual conferences. And it's also, I think, applicable under other, since there's not technically travel, but were they in-person conferences, you'd probably put the registration under there. Either is appropriate, as long as you label them as such when you submit the budget form.
Awesome. And then another question also from Tamara Mills. Is the full financial audit and the IRS 990 form required if a school system is applying?
I can field that one. I do not believe that a full financial audit or IRS 990 that is specific to non-governmental organizations. So requirements.
Great. Next question is from Linda Williams. Can community-based nonprofits working in the same county apply together for a project?
I think it would be, as long as the application is clear and in kind of demonstrating who's doing what. I think that is more than appropriate. When we go to make the grant agreement, I guess we would have to work with our Assistant Attorney General to figure out the logistics of that. But it would just need to be clear, very clear in that application, who's managing the finances, whose responsibility it is to do X, Y, or Z.
Great. And I think maybe just one or two more. Nicole, this one sounds like it might be up your alley, but this one comes from Sarah Kerr. Are there any performance measurement examples for public awareness grants that are not impressions, other than impressions? You're on mute.
I think some of it comes down to like what your other activities are. And, I mean, and if you're collecting, if you're also posting, I suppose, like events that you're then disseminated information, it'd be like the number of information shared, number of events attended to then provide that type of material. If you are able to kind of because you're not really getting into evaluation. So thinking about just going through what activities you're doing and sort of what are some ways to measure either how well you've been able to implement or sort of the impact of those activities.
Awesome. And I'm just going to call it, this will be the last question for the group. This comes from somebody who doesn't have a name. They have a weird code, but the question is, are the additions of the main strategy and the expanded information about target populations the only significant changes to the application this fiscal year?
Hi, Michael, I can take that one. Yes, those are the two main changes over FY 2021. Everything else remains the same over last year.
Great. Awesome. Well, thank you all very, very much for attending today's session. Thank you to our speakers. Special thanks to Nicole Sealfun for joining us and contributing and teaching us about writing smart objectives. And it was a great session. I'd say look out for more announcements from us coming soon. If you have any additional questions, grants related, please feel free to shoot them to any OOCC people on the call today, but specifically Danielle and Khalil will be your grants contacts. And then also Teresa will be your main point of contact for anything OIT related, but we're here and happy to help and happy to answer any additional questions that you might have. The OOCC will be coming to you again probably next month, although date TBD with the next installment in our webinar series, which will be just some basic information about our office and what we do. So OOCC 101, if you will. But with that, I will leave it there. Thank you to the people who hung out for the Q&A, and thank you to our speakers, and have a good rest of your day, everybody.
Thank you, Michael. Take care, everyone.
Take care.